Hello, everyone. Dr. Evelyn here with Pet Nutrition Doctor, and today we're going to talk about light therapy. As some of you may be aware, I now offer light therapy to my clients. You can actually get this nice little unit delivered directly to your door so that you can treat your pets without having to load them in the car and take them to the vet. You can treat them as often as is indicated by their condition and is allowed by your lifestyle. And you don't have to worry about the stress and maybe even pain of getting them in and out of the car, which does diminish the value of the treatment. So I'm really excited today to have some help teaching you about light therapy. I'm joined today by Aubrey-Chimene, and I hope I said that right. You can correct me if I'm wrong. She's been studying, using, and training on light therapy for over 25 years. She's internationally known for bionutritional consulting and light therapy educating. And she founded the Photonic Therapy Institute. She's a writer, a speaker, and an international educator. She hosts weekly webinars for her students and the public on best practices for using light therapy and getting the most results, the best results. She has her BS in animal health sciences from the University of Arizona. She completed graduate studies in nutrition, biochemistry, and evolutionary behavior. But it doesn't end there. She's a Reiki master, a teacher. She's certified in light therapy instruction. She holds a certificate in bioenergy analysis, kinesiology, equine and canine massage therapy, EFT, acupressure, and experiential training techniques. She's also the executive director for IRB research study into photobiomodulation and inflammation for COVID-19. Maybe we'll get a chance to get into that a little bit too. But you can find out more about her on her website, photonictherapyinstitute.com. Kay, thank you so much for joining us here today. I'm really excited to learn a little bit more about the light therapy.
Oh, I'm glad to be here. You know, it's my passion, and I'm never shy about talking about it. Just be careful. If you ask me too many questions, we'll be at this a long time.
Okay, all right. Well, I think to start, what I'd love to do is just explain what light therapy is. I think, many of my listeners may not really know what it is. Can you explain how it works and a little bit about it?
Sure. When I first got started in this about 25 years ago, you tell somebody that you could help lower pain and increase circulation and help the body with light, and they would just roll their eyes and go, "Oh, you're one of those crazy woo-woo ladies. Yeah. You know, bring out the crystals and the stones and the essential oils." And luckily for me, it was enough of a passion, and I saw so many benefits that I stuck with it, because now medical science is catching up. And the new word for it, which really encompasses what light does, is photobiomodulation, which is literally modulating or balancing the biological processes of the body with light. And there are certain specific wavelengths of light that get absorbed by the body. Our blood absorbs red light. Okay. The water in our body, which is most of our body, absorbs near infrared light. And they're in the blue, red, near infrared spectrum. We can use these wavelengths, apply them to the body. The body absorbs those packets of light, the photons, and each cell then gets the energy it needs to do its own job better. So brain cells do brain work better. Blood cells do blood work better. Muscle cells do muscle work better. Nerve cells do. So it's giving energy to the cell to be able to do its job. Right. And that's the highly unscientific way of saying it. But the funny thing is, the more intense the researcher, the more they've had to break it down to that point, because we don't really know all of the different ways that the body puts those photons to work. We think we do, and then every few months we get a new aha moment. But in general, the best description I ever saw in a research paper was light gives every cell the energy it needs to do its own job better, period.
That's fascinating. I mean, we know that plants need light therapy, right? And we always think we're so different from plants, but it's all biological systems, and it's fascinating. And it puts a little bit more light into the idea of sunlight as being therapy. Of course, we know sunlight makes a difference in terms of making our vitamin D, but it does other things as well.
It does. And many people say to me, why can't I just, why, if my horse is standing out in the sun all day, why does it need light therapy? Well, of course, the sunshine is a broad spectrum. Only a tiny amount of that is what's absorbed by body. And there are negative effects to the UV and many of the other outside the visible spectrum light. Plus, it's not targeted. And one of the things we've learned is the more we target, the more we identify for the brain or for the nervous system exactly where we need help, the better our results, the better we can tell the body what we need and have it respond. So when you walk out and it's 100% of the body getting irradiated by the sun, even if that was just beneficial wavelengths, it would not necessarily tell the body where we have an issue and where we need that support. Okay.
Right. Yeah, that's fascinating. And getting into the same idea, can you explain the difference between, or maybe the difference between the terms light therapy and laser therapy? Because I think a lot of our listeners have learned or heard of laser therapy. Maybe even they've gone in and gotten laser therapy for their pets. But is there a difference?
To your pocketbook, yes. To the body, no. All right. So a laser is a way of forcing all those photons of light to go in exactly a straight line. They all march in lockstep. So if you go get a little laser pointer down at the dollar store, you can point it at the wall 20 feet away, and most of that light is all going to still be within this little teeny tiny space, 1 millimeter space. But if you used a flashlight, which is non-coherent, so the laser is what's called coherent light. The flashlight is non-coherent. So as those photons are emitted, they spread out, right? And the further you are from the wall, the more that light covers, the more area it covers. Well, the same thing when we're doing light therapy. If you need your light to all be within 1 millimeter space, very targeted space, maybe you need to light up one specific nerve. And this is something they're doing now. They're doing laser with anesthesia.
Interesting.
Where they're literally suppressing the nerve's ability to tell the brain that there's pain. And there's a researcher in Australia, Roberta Chow, that's doing fascinating work with this. But that's where lasers shine, pun intended, is getting that light into that very, very, just lighting up that nerve. Okay, very specific amount of light into that nerve. But in general, the body, to trigger photobiomodulation, or the increase of cellular respiration, lowering pain, increasing circulation, flooding the body with nitric oxide, the things that light does for us, it's actually better when it's covering a bit more space, right, than that 1 millimeter. Mm-hmm. It's a better use of our light. We don't have to be waving it back and forth. And most of those $30,000, $40,000, $50,000 laser systems that veterinarians and surgeons and so on have invested in, the only training they really get is, we'll turn it on for 3.5 minutes and wave it over that area this far away, right?
That's absolutely true.
They don't know anything more than the general public does on why it's helping, on how much to use. The whole idea of how much for how long is that's the most debated point out there. And there seems to be, especially the faster we deliver the light, the more dosage or how much light we give becomes into play, because if we give too much too fast, we get no benefits. And the beautiful thing about something like the Lumed Lume that you use or some of the torches that I use is they're not delivering it so fast like a laser would, or most, not all lasers, class 4 lasers would deliver so much light so fast that they have to be very, very specific and not overdose because you won't get the benefits. When we do it at a lower level, like 75 milliwatts of light per centimeter squared, the body, it's at a rate that the body can absorb safely and still get benefits. So
That's really, yeah, that's interesting.
laser versus LED, the body doesn't care. Okay, it responds the same way. What it cares about is what color of light you're using, how much you give over time, and if you pulse that light or not. Those are the things that the body responds to.
Okay, that's fascinating. That is really fascinating. And you're right. I've been to some of the laser training for veterinarians for those very expensive units, and it's a plug and play. And you ask the question. I've asked the questions about changing up that therapy, and at least the trainers don't seem to have the information that you have. So I appreciate you kind of sharing that. And it does make a lot of sense that, you know, if we have a larger area and we give it a little bit more time, we're not going to overload the cells. So they're going to be able to kind of take that in a little bit easier. So that's
Yeah,
fascinating.
one of the, laser at this point is a sales tool. The laser companies have a lot of money invested in convincing veterinarians and physicians and lay users that they need to spend $25,000, $30,000 to get any benefits. And they say, oh, it penetrates more deeply. Like somehow you have to have this very high powered coherent laser to help mend a bone that's deep under the muscle. And yet for 25 years, I've been using LED diodes with as little as 7 milliwatts, very, very low output, and having amazing responses from draft horses with broken bones, deep down in the hoof, deep down in the brain of humans. So we know that there's a difference between how much light, how deeply it will initially go, and even that's not power dependent, it's wavelength dependent. And then total penetration, which really comes down to saturation. And as we give the light slowly, I tend to liken it, again, very unscientifically. If you use a laser or you use a very high output panel or something where it's extreme amounts of light, it's like putting your client underneath a broiler. What happens when we broil meat for too long, right?
Yeah.
Whereas if we put it into a slow cooker, it softens, it tenderizes, it doesn't destroy the tissue, it doesn't burn it. Well, obviously, we're still not cooking ourselves with the light. We're not using the kind of light that heats up the body, but we get a better response, and it's at a rate that the body can absorb rather than just reflecting it back and getting warm.
Right. That makes so much sense. And it helps to explain a lot about the laser. And you're right. One thing we're taught is wave that thing around so that you're not constantly hitting that area and overloading it. But it's not a matter of what you're doing or where you're supposed to wave it. It's just wave it, just move it around and cover the area.
Yeah. And where you put it, we teach people that where you put your light is more important than how much light you give.
That's fascinating. And that
laser,
makes it a lot easier.
We do laser and or photonic acupuncture, what I call photopuncture, which is the activation of acupuncture points. Dr. Brian McLaren, who really pioneered that 40 years ago, he was using low-level diodes for 5 seconds per point.
Wow.
That's how little it can take if you know where you're shining your light.
Right. Yeah, it's like doing little acupressure points. You can kind of tap on those points and you can still get some results, even if it's just a light tap and it's just in the right place. So that's
right.
That's fascinating. So what kinds of things do you use light therapy for? And maybe can you share an example of a case that you've used it and the outcome?
Well, I think the more appropriate question is, what don't we use light for? Because around here, the first thing I reach for is light, whether it is a pulled muscle, a broken bone. We have a light therapy center here. We do rehabilitation for horses. I also have very active pet clientele. With animals, the number one reason dogs go to the vet, allergies. We lower allergic responses in minutes. Hip dysplasia, arthritis, spondylosis, aches and pains in general, ACLs. I have literally worked with hundreds of clients that never needed ACL surgery because they immediately started using light therapy wraps or wraps and photopuncture to help reattach and heal. In fact, one of my very good clients, I have an Anatolian Shepherd and a Corgi, a Cardigan Corgi, from a woman who breeds both. And she's been a long-term client. I used to work 20 years ago. I worked at dog shows constantly. And she gave me a Corgi bitch. Who's here with me somewhere. She's about 14 years old. And this bitch's son at the time, about 6 years ago, was #1 in the US in the dog show world. And he was going up to Canada to get his international championship. So she was doing a series of dog shows, both in Montana and then on the other side of the border up in Canada. While she was up there, this dog ripped his ACL. This dog was slated for Westminster and Crufts. And when you've got a dog at that level, you're spending tens of thousands of dollars a year getting them shown and advertised. And she was crushed. Well, she goes to the vet there in Canada. And of course, he says, all right, we got to do surgery. Well, she has been a breeder and shower for enough years that she knew that if she had surgery on this ACL, that's going to shorten the ligament. And the dog will never have the same stride. He would never be in balance. He'd never be in the show ring again. So we overnighted her a light therapy wrap and a photopuncture torch with some charts for where to light the dog. She got back. She still stayed at the shows because she had a number of other dogs she was showing, came back down, started working with another one of my clients who's a holistic vet here in Tucson, and they were swimming the dog and so on. The next year, he was back to #3 in the nation. He got in the top 5 in Canada. It took him about 14 months and he was completely rehabbed and balanced. And he's still winning best of breed out of the veterans classes at 11 years old.
Wow. That's an amazing story. And I don't know of any ACL tear, partial or complete, that recovers like that, because either way, we typically get a lot of scar tissue. We typically get that thickening of the knee, and as you say, the shortening of the ligament, and there's almost always some arthritis or some gait change in these dogs. I mean, they can have a good functional life, but not like that, not where you could show them and have that normal gait. So that's really impressive.
One of my students, and we did a summit earlier this year on light therapy for pets, and 2 days, and one of my now students was a client who, she's a woman in her 70s. She had a 170-pound Great Dane bitch that blew an ACL.
Oh, ouch.
Right after she had taken my first class. So she had light therapy wraps. She had she had torches, and she had gotten a wrap system for herself. She's 75. She's got some aches and pains. She's a tiny little woman. She's about 5 foot tall. So when a 170-some pound Dane loses an ACL, oh my God, how are you going to get it up and out? And she lives in Seattle and was downstairs and steps and all of that. She started doing light on the dog. The veterinarian was absolutely astonished because within 3 weeks, this dog was hopping into his office. When they had a terrible storm, lots of ice and snow, dog slipped and fell and ripped the second ACL.
Oh my gosh.
And, the serious thought was euthanasia. Dog can't stand. What are we going to do? I can't lift the dog. I'm tiny, right? The dog is huge. She started doing light therapy on her immediately. She had her off the pain meds because she didn't want to be using tramadol and so on for long. Had her off the pain meds within very short time. And that dog was up and walking and under her own steam back to the vet in 90 days.
That's incredible. That's just, yeah, that's unheard of. So those are incredible stories. And I'm fascinated about the allergies. How are you treating the allergies with light?
We are activating acupoints that help the body to lower the histamine response. And everything that we do here, my approach is always the same. Somebody says, I've got a dog with allergies, have a dog with cancer, have a horse with Cushing's disease. We always take the same approach: cleanse, nourish, balance, right? So everything that we do begins with detox.
Got it.
Right? When you get all the junk out of the liver and kidneys, they can do a better job. We see most allergies being directly related to, and I'm sure since the name of your business is nutrition, it's directly related to the foods that we're feeding and poisoning our way to health with paste wormers and all of those things. So we use all of our torches that we use for photopuncture go out with a recipe called Health and Balance Points. And these are master acupuncture points for bringing up the immune system, flushing the lymph system, helping with, urinary tract, all of that, cleaning out the body. And then when we're dealing with an allergy animal, we also throw points on that lower the histamine response and flush the lymph system even further. I got pictures yesterday from somebody who started using, she has a Weimar on her that was very, Weims have such thin hair anyway. And you could see that the initial photo, the Weim was very irritated and red and had started losing all the hair along the inside of his back legs. She showed pictures yesterday at 14 days. He has got all of his hair back and all of his skin is completely clear. All she did was start doing the points. She didn't even change diet, which we recommended.
Right. That's fascinating. That's incredible. I'm going to have to contact you about some of my difficult patients because I would love to learn more about that myself.
Well, and I don't think light is the only thing we do. I think nutrition is a big part. Detox we can help assist that with light, obviously, but we can also, we need to do that in addition to stopping the toxins from going in. And detoxifying through supplements, through even raw apple cider vinegar in the water, etc. But then the light helps to maintain that process, speed up the body, and sometimes detox can be a pretty exhausting thing, can overwhelm, and so we help support the organs of elimination so that the dog or the human doesn't get so exhausted during the process.
Right. And that's exactly my process as well. I've always done the detox and the nutrition. And I typically get huge results, but I have some patients that they still have that residual and we're missing something, but perhaps light might be a wonderful way of just getting that last little bit taken care of.
Right.
Right. It's great to have some relief for these guys. And we can, I can bring it down 75%, sometimes 100% in some of them, but there's some that just are, genetically probably missing some of the pathways and just really have a challenge with all of the toxins that we're hit with every single day.
And they can be born toxic, right? I see breeders worming these bitches multiple times before they have litters of puppies, or worming the mares with ivermectin and very toxic. I know collie breeders who are still using ivermectin on their bitches, and I'm like, this can kill collies. And so we try to teach them about, if you need to worm your animal, use herbs, use diatomaceous earth and clay. Don't use things that are going to poison your way to health, as it were. But yeah, they could be born toxic. And if grandma had very low energy and didn't have healthy eggs to pass on, then the puppies can be born without full expression, genetic expression. So, yeah.
Absolutely. The other thing that I see sometimes is puppies that are sick early on, and they get massive doses of antibiotics and
Right.
just wipe out that whole microbiome. And getting that back is super challenging.
Oh, I
So,
have something for you when we're off.
okay.
I'll point you towards something I love for that.
Okay. Awesome. Awesome. Well, you've shared so much, and I really appreciate all of it. I wonder, do you have a fun or funny story to end this with? Something about your experience with light therapy that you'd like to share?
Well, usually it's about helper horses. And when I was first starting this, I was using a machine called a bioscan machine, and it was about $7,000. So it was an expensive piece of equipment. But, in horse world, you're more aware of this. So this is 25 years ago. I saved up, I bought this machine, and you were using 2 cluster heads of red and near infrared LEDs. And we didn't even know at the time that what we were activating was acupoints. We had a little scanner and it would beep, and they said, oh, that's where the pain is. Well, it could be because there was heat there, but more often it was blocked energy for an acupoint as we learned more. But I can remember going up to a horse that was rather skeptical, didn't know me anyway. And I had this set at a pulse rate that is very activating. We use it for nerves, and we call level 1 for old, cold, and dead, right? It's kind of like putting your truck into low. It's not the fastest, it's the most power. But you don't see a difference when you're the person doing the dial. You just turned it to low. Hey, we're going to start by waking things up. This horse was going to kill me. I mean, ears pinned. Nope, you ain't coming near me. Nope. And so I backed off, and we all talked about it. I said, okay, well, let's try starting at the other end. Let's try starting at the sedating levels, and we turned it up. Well, the horse almost followed me into the car to go home.
Wow.
As soon as we changed the pulse rate on the lights, this horse became my best friend. Turned, instead of having her butt turned toward me, her eyes softened, her ears came forward, she nickered. And we're all standing there going, well, I guess she likes this one better. And this was early on in what I was doing. So it was, horses and dogs have been my best teachers. They tell you when this is wrong.
This is, yes, so true. That's fascinating.
I did not realize how much light could do a chiropractic adjustment. And I was working at a dog show, and I had done a lot of body work and physical physical manipulation for chiropractic for years. And I had somebody bring up a little Australian Terrier. So basically 15 pounds of solid muscle, right?
Yep.
Neck on him like a tree trunk. And she brought him over, and I started working on him, and I realized that C1 was really kinked and right up against his jaw. His neck was really hurting him. And luckily I showed his owner, had her feel so she could feel that it was out of balance. And I brought the lights, and I did my little stuff, and I had the lights just sitting right there on his neck, talking to her. And all of a sudden we heard a huge pop, and this dog reached over, and he had hit my hand in his jaw. But he didn't actually break skin. He didn't bite me. The owner was starting to get really mad at him. I said, no, it's okay. I just hurt him. She said, well, you haven't done anything. And I said, let's check. And I put, and boy, C1 had popped back into place. And the subluxation had completely let go. And I had her put her finger in that groove, and she was like, oh my word. And that's when I started paying more attention. Again, like this is 20 years ago, I started paying more attention to rebalancing the structural alignment with light as much as we were lowering pain and healing tissue with it.
That's crazy. Do you think that was due to muscle relaxation that allowed that to go back into place?
I think it was rebalancing. What we've determined over the years is it's rebalancing the tension and laxity of the ligaments and tendons on either side, and the muscles, of course, holding them. Because, the old joke is, why do you have to, you have to go back to the chiropractor 18 times, because the longer it's been out, the more the muscle memory is going to pull it right back out of whack, right?
Yeah.
But when you just release that muscle memory and bring the tension back into balance, we almost never have to do a physical adjustment anymore. Unless there's
Wow.
specification.
You're going to put the chiropractors out of business.
Well, no, but I have a lot of chiropractic customers now.
Yeah, I'll bet. I'll bet.
Yeah.
Wow, thank you so much, Kay. That was just that was amazing and enlightening. Can you tell people how to find you and what you offer?
Certainly, certainly. So our main website is photonictherapyinstitute.com. And please be patient with us. It really was developed, the site was originally developed when we were teaching a lot of live classes. As you might imagine, we're not doing so much live now. And the beautiful thing about enforced COVID staying home is that we've gotten all of our courses online now. And so we offer online courses in helping horses, dogs, and humans with both light therapy, the more general photobiomodulation like you do with your Luma, all the way up to targeted work with photopuncture. So we offer those classes online and live with Zoom. And we do sell tools, but primarily our focus is education. So we take, we talk that our goal is to teach any person with any tool for any species how to get the best results from their light.
That's fantastic. I noticed you didn't mention cats, and I do have a cat that I've been using it on, but she's not terribly cooperative. So
we do, and we have a lot of customers. In fact, shame on me for not mentioning cats. My sales director, Dell, will smack me for that because she's a cat lady and my partner, Karen, is a cat lady. We don't teach the classes on cats because cats don't stick around for a 6-hour class very well. They don't put up with a lot of manipulation.
Mhm.
But everything that we teach for working on a dog, we also use on the cats. We check for range of motion and balance the same way on both types of quadruped. It's very different on a horse. We don't try to do range of motion and stretching on a horse quite the same way. So, but yes, we teach a class for pets, taught through the structure of the dog, but the results, the information can be used, dog, cats, ferrets, any four-legged.
Fantastic. Yes, and I have been using it on my 17-year-old cat, and I do think that I'm seeing some benefits from it. She's not terribly happy. Once we get her into place, she's fine, but she's never been a cooperative patient.
I've always found that with cats, dogs to some extent, but cats are smarter than we are and they know it. And what we'll often do is put a pad down and let them lay on it. And they get to choose when they leave, etc. If we're doing targeted work, once we've done a couple of health and balance sessions or a couple of hip balancing sessions, they're all for it. But yeah, sometimes you have to do a little bit of convincing.
We're getting there. She's getting better, but it's still a bit of a challenge. So, but I know that it's going to work regardless. It's a biological system, and it's going to work the same way on a cat or a dog.
Right. And the beautiful thing about light is there's no reason not to do it. We're not causing liver failure by a drug that causes an issue. We're not going, so especially with animals, when you let them make a choice, they're never going to let you overdose them. We do have a Facebook group called Photobiomodulation for Animals. We'd love to have people come we've got a lot of practitioners in there that are very knowledgeable and will help people when they have questions. And people are welcome to come in with questions, with brags, testimonials, concerns. Hey, what do you think of this light? So anybody who wants to learn more about using the Luma or any other light with animals, they're welcome to join us.
Fantastic. Thank you so much. I really appreciate it. It's been great having you. You've been just a wealth of information. And I know that your website also has a lot, and I'm excited about that Facebook group too. I think that'll be great for anybody interested. So thank you.
You're more than welcome, and we hope to see you join us there.
Okay, sounds great.
One of the places we most focus for the COVID is lighting up the entire neck and throat. Stops the coughing, helps to lower the panic attacks over not being able to breathe. Okay, We do have a website. It's called covidlighttherapy.com. It has got all we keep it up to date with all the latest research coming out on photobiomodulation and nitric oxide for COVID. We have the research study in place. We are actively working with people on the inflammation portion of it right now. We'll move into the COVID once we've got the emergency use authorization for PBM for COVID, and that's coming.
Wow. I'm impressed that you're getting that authorization. I thought it was all the pharmaceutical companies that were getting that.
We already have the IRB in place. All right.
What is IRB? What is
an IRB? Is an institutional review board research study.
Okay.
So that means it's peer reviewed. Okay. So we already have an approved study for PBM, photobiomodulation is approved for pain relief and increasing circulation.
Right.
It's not approved for inflammation, which is considered a disease process.
Okay.
The beautiful thing is, because it's a disease process, it has a biological blood marker. Right? The C-reactive protein. So Marcy Denton, who I work with, who's the researcher that I work with, she actually put together a research study that got approved. She had no money. She had no way of organizing it. So I did the organization. She got the approval. We've been writing the study. Then we worked together on this website. And the website is just really general basic information. Why does light help with COVID? Because it's releasing nitric oxide. How to use it for prevention, how to use it for intervention, and how to use it for recovery. And then how often, right?
Right.
Different approaches, how often to get it up into the sinus passages, how often to use it on the chest, etc. And then there's a whole slew of the latest scientific references about COVID and nitric oxide inflammation and photobiomodulation.